Good evening, guys. My name is Mackenzie Pacifico, and I'm going to be talking to you guys tonight about the differential efficacy of first-generation antipsychotics and second-generation antipsychotics used to treat schizophrenia. So schizophrenia is a severely complex, debilitating neurological disorder that affects a person's ability to live normally like we do. So some schizophrenic symptoms, the two categories are positive and negative symptoms that we usually see. So positive symptoms are the ones that are in addition to. So the delusions of false belief and the hallucinations of the seeing and hearing things that aren't really there. And negative symptoms are ones that are usually the lack thereof. So the lack of proper hygiene, the lack of organization, the lack of emotion that they show, and the lack of motive to live a life that is normally lived. The cause of schizophrenia, it can't simply be pinpointed to one specific problem in the brain, but all of the theories usually revolve around the overabundance or deficiency of certain neurotransmitters in the brain. So the dopamine and serotonin are the two neurotransmitters that usually the theories revolve around. Dopamine, there's 4 dopaminergic pathways in the brain that usually a difference in these pathways are what cause the schizophrenic symptoms. So the two main ones that affect the positive and negative symptoms of schizophrenia, the mesolimbic pathway is this one right here, the dashes and the dots. That is going to, when there's excess dopamine, that is going to produce your positive symptoms of schizophrenia, so the hallucinations and delusions. The mesocortical pathway, this one right here with the solid line, that a lack of dopamine here in this pathway is what is going to produce the negative symptoms or the cognitive dysfunction of schizophrenics. So first generation antipsychotics are characterized by being dopamine antagonists, specifically D2 receptor antagonists. So these antipsychotics are going to block dopamine receptors so that the excess dopamine doesn't bind and produce certain symptoms. Here's a list of a few of the first generation antipsychotics we'll talk about a little later. Second generation antipsychotics are characterized by being dopamine and serotonin antagonist, so it blocks both of these receptors at the same time from excess dopamine and serotonin to produce less of an effect of the positive and negative symptoms experienced. And here's a list of a few of the other ones we'll talk about later as well. My intentions and the purpose of this was to discuss the differential efficacy between the two, looking specifically at the age and gender of the schizophrenic and the presence of the positive and negative symptoms. So whether first generation or second generation antipsychotics work better in people who are older or younger, or males versus females, and whether they are more hallucinogenic or delusional versus the negative symptoms with the lack of organization and the lack of hygiene, the lack of emotion, things like that. While also at the end looking a little at some of the adverse effects and complications regarding other organ systems in the body, like the endocrine system and the cardiovascular system, where we see some effects of these drugs as well. So first, looking at age and gender, this study is comparing quetiapine, which is a second generation antipsychotic, and haloperidol, which is a first generation antipsychotic. So looking specifically at the mean age here is 32 in one group and 35 in the other. So relatively young compared to the other studies we'll look at later. And looking at the sex, male to female ratio, there's tends to be more males than females. That's just the way the disease affects the population. There's usually more males affected than females. So looking more at the results here, they took a baseline at the beginning of the study and compared it to 8 weeks out, 2 months, and they measured in different categories, specifically the PANSS stands for positive and negative symptom scale. So just looking towards the positive and negative ones down here, the Q is the second generation and the H is the first generation antipsychotic. So comparing both, there was a decrease in these mean scores of the positive and negative symptoms between the baseline and the 8 weeks on both the first generation and second generation. But so the second generation worked a little better with this age group. So we'll look at the cues here. The decrease was a lot greater in both the positive and negative compared to the H, the first generation. So it was able to improve the positive and negative psychosis symptoms without adding any extra symptoms. While if you look at the H, the first generation, it did decrease, but it wasn't enough to significantly reduce any of the symptoms or decreasing the neurological deficits for this relatively age group too. So comparing that to this study, we're just going to look at the first column and the last column. Looking at the mean age, it is severely greater than the last one. So we have 41 and about 42 over here is the mean age. Here in this study, although the ages are slightly higher than the last study, the male to female ratio is about the same, more males than females, as in the other study. Looking at these results, so we're just going to focus on these first two bars. This is taken from baseline to 2 months and baseline to 18 months. So the first bar, the olanzapine, that is the secondary antipsychotic, and the parafenazine, the second bar, the darker one, is going to be the first generation antipsychotic. So from baseline to 2 months, the second generation antipsychotic doesn't seem to be working as well as the first generation here, and moving to the baseline to 18 months, the second generation antipsychotic didn't move much. It did increase a little, but not much more than from 2 months. But the first generation here almost doubled in the improvement of the neurocognitive composite score. So it seems here that with possibly the older age of the slightly older age of the patients, it was better for the first generation antipsychotics rather than the second. So I also looked at the presence of the positive and negative symptoms and whether the first generation or second generation worked better with those. So here, this study is looking at clozapine. So that is a second generation antipsychotic, and looking at the positive and negative symptom score here again, there was a severe decrease in both the positive and negative. So this decrease here shows an alleviation of the positive and negative symptoms, along with improving the full scale IQ down here as well. So moving down to these results, this is the same results from before of the study comparing the first generation and second generation antipsychotic, but we're going to focus a little more on the difference between the Q and the H here. So the Q was the second generation and the H is the first generation. So as even though they both did decrease, the decrease in the second generation antipsychotic is far more severe than the first generation antipsychotic. So showing that the second generation is better at alleviating the positive and negative symptoms, but also not bringing on any more symptoms than the first generation was, where there was a decrease, but it wasn't significant enough to say, hey, this is working a little more than the second generation antipsychotic is. Took a quick look at the first generation antipsychotics versus the second generation, having some adverse effects on different organ systems. So these drugs do have side effects, but they can have some detrimental effects on the other organ systems, like the cardiovascular, endocrine, and the central nervous system. So these results looking at the difference between first generation and second generation, and weight gain and extrapyramidal symptoms. So you can see the first generation doesn't cause as much weight gain, but there's an addition of many positive, negative, or motor symptoms neurologically. Now, second generation is the almost the complete opposite. There's more of the weight gain, so the interference on the endocrine system, and less of the extrapyramidal symptoms, which is less of a neurological effect, side effect. So just as a kind of a conclusion, when you're looking at the age and the gender of the schizophrenics, it seems that the lower mean, with a lower mean age, so the younger, the second generation antipsychotics tend to have a better outcome than the older you are. And with the higher the mean age, the older the person, the more likely the first generation antipsychotics would be a little more successful. Regarding the gender, it seems that first generation and second generation antipsychotics, they have the same efficacy. Usually they're in studies, there's more males than females, so that was a little harder to look at. With the positive and negative symptoms, second generation antipsychotics seem to work best when to alleviate those symptoms versus the first generation antipsychotics. The second generation antipsychotics also tend to improve cognitive function, as well as the symptoms. And it seems that first generation antipsychotics tend to have more of the adverse effect on other body systems, like the endocrine and the cardiovascular system. Overall, the second generation antipsychotics seem to be a better fit overall for any age group or any type of symptom, or any gender, male or female. But I would be interested in looking at the addition to these the antipsychotic drugs, adding on any sort of therapy, or looking at their family life and their home life, whether they have those connections between family and friends, or attaching electroconvulsive therapy on top of that, which is a non-pharmaceutical way to treat schizophrenia sometimes. I would also